I'm Dr. Sherry Kotari, Director, Health Innovation Campus, Lancaster University. Health Innovation at Lancaster is a groundbreaking initiative designed to bring new ideas and a fresh perspective into how we tackle some of the challenges we face in health. Why is this important? This is important because, first of all, health affects us all. Secondly, we are all living longer, and we don't want to compromise on our quality of life as we get older. So our approach at Lancaster is to bring together disciplines from across the university. So not necessarily working with people who have had a health background, but to bring people from backgrounds as diverse as material science, as engineering, even people who work in architecture and design and in digital health. We want to bring all of these people under one roof to think about different ways of tackling some of the biggest challenges we face in health and healthcare. I'm a strong supporter of how institutes such as the Material Science Institute can allow us to actually bring fresh ideas into how we tackle health challenges, but also to help reach out into the community, into the local healthcare trusts, as well as to connect with businesses.
My name is John Goodacre. I'm the Associate Dean for Engagement and Innovation in Health and Medicine. When we're thinking about the challenges of health, not only locally but around the world, the issues are around how can we enable people to live well and healthily for as long as possible? How can we enable disease to be diagnosed and detected at an early stage? And if those conditions need to be managed, how can that happen in homes and community settings rather than in traditional hospital settings? And the drivers behind this thinking arise out of a number of factors. For example, there is an increasingly changing demography, particularly with an increasing proportion of our society comprising of older people. There are changes in the pattern of disease. So, for example, more and more people having more than one long-term condition to have to deal with and manage. And of course, we have to face the reality of the increasing cost of health care. And here at Lancaster, we've over the past few years built upon our excellence in research and teaching, which has enabled us to involve literally every academic department and a whole range of academic disciplines. And that background, that journey, that ethos is very central to the way that we think about the Health Innovation Campus in the future.
My name is Professor Ihtisham Rahman. I'm Professor of Bioengineering. I have been working in this area for more than 30 years now in the field of biomaterials, working on dental materials and also using spectroscopic techniques to identify the chemical structural properties of various natural and synthetic materials. Addressing health issues, health problems, innovative approach is required. And that innovation, either it is in materials or it's innovation in technology. That has to be combined together. Clinicians or non-clinicians, different disciplines, they have to work together and form partnerships. They need to connect with each other. They need to work for the targeted goal, and they need to work for a targeted application. This is the key. And that requires an innovative approach. That requires an interdisciplinary approach. And I strongly believe at Lancaster University, Material Science Institute, that will provide that needed platform and work for the targeted goal for a targeted application.
I'm Dr. David Chandler, a lecturer in the Engineering Department. Lancaster University's Material Science Institute is a great place to develop innovative materials and technologies because its collegiate atmosphere leads to high quality research. My research involves the characterization of complex biological materials and the development of sensing technologies for point-of-care diagnostics and fundamental biomedical research. The Engineering Department is an integral part of the MSI and we are able to engage with clinicians and academics throughout the Faculty of Science and Technology and the Faculty of Health and Medicine in health-related projects. The proximity of experts from the different disciplines allows us to collaborate closely and develop projects in the healthcare field from low technology readiness levels up to translation, to industry and to the NHS.
I'm Professor Rob Short. I'm the Director of the Material Science Institute, and it's my great privilege to lead the Material Science Institute, but I'm also an active researcher in the Institute. My research is on biomaterial surfaces. I manipulate surfaces for the binding of proteins and the binding of cells, and we utilise my technology in the fabrication of diagnostics for the early detection of disease and for early intervention in terms of biomedical devices. I've been working in the field of biomaterials and tissue regeneration for over 20 years, but in the last 5 years I've started to focus my work on unmet patient needs. Particularly, I'm focusing on technologies that can address problems that arise from non-communicable diseases, where we see a growing incidence of these diseases in the population as a result of an ageing population and the rise of diabetes. Particularly, I'm working on low-cost cell therapies that can be used to promote healing in the earliest stages of these wounds. Therefore, avoiding radical interventions that could include amputation. I really enjoy working in the Lancaster University Material Science Institute. It gives me the opportunity to work not just across the faculty, but across faculties, and it allows me to link up with researchers who have a much better understanding of the complete picture of the diseases on which I work. For example, population health aspects of chronic wounds, and also the psychology and sociology of wounds. And I think it's by this one Lancaster approach that we can bring real impact to our research.